Hello again, student doctors. Now we're going to talk about Esmolol. Once again, added a link. You click on it, myriad information, much more than you need to know for the exam. But it's good to have this at your fingertips in case you need it. Pharmacology, metabolism, pharmacokinetics. Here's a picture for your perusal of the vial label as well as the structure. Beta-1 adrenergic receptor is a G protein coupled receptor that's expressed in heart. When these receptors are stimulated, they increase the heart rate and the heart strength of contraction. It's a class 2 antiarrhythmic agent. What that means is it competitively blocks response to beta-1 adrenergic stimulation. And this drug has little to no effect on beta-2 receptors, except at very high and likely toxic doses. The lack of activity at beta-2 receptors, except at high doses, there's no intrinsic sympathomimetic activity and no membrane stabilizing activity. So Esmolol affects the response to nerve impulses in the heart. Thus the heart beats slower with lower blood pressure. Increased blood and oxygen to the heart is the result. Esmolol can be used to control rapid heartbeats or abnormal heart rhythms. It can also be used during surgery or after surgery or during other medical procedures. Esmolol is contraindicated in patients with bronchial asthma, overt cardiac failure, cardiogenic shock, severe sinus bradycardia, or other conditions associated with severe and prolonged hypertension. Additional contraindications for Esmolol include a history of hypersensitivity to any component of the product, as is always the case, history of obstructive airway disease, including asthma, any heart block greater than first degree, except in patients with a functioning artificial ventricular pacemaker. Additional contraindications for Esmolol include decompensated heart failure, IV administration of calcium channel blockers, for example, verapamil, in close proximity to the administration of Esmolol, or any other drug that has cardiac effects that are still present. Pulmonary hypertension as well. So I consider this an important and interesting table regarding considerations for use and indications for Esmolol, particularly for surgery for aortic dissection incidents. There are contraindications, major side effects, and some special notes we're going to touch on moving forward. There are numerous considerations for pregnant women. Exposure of the mother to this drug may cause fetal bradycardia, and this effect may continue after Esmolol is discontinued. If maternal use of a beta blocker is warranted, fetal growth should be monitored during pregnancy. Newborns should be monitored for 48 hours after delivery for bradycardia, hypoglycemia, and respiratory depression. Because Esmolol is a short-acting beta blocker, it's not indicated for the chronic treatment of hypertension. However, its use can be considered as an alternative agent for hypertensive emergencies during pregnancy. Agents other than Esmolol may be preferred for the treatment of supraventricular tachycardia, atrial fibrillation, atrial flutter, and ventricular tachycardia during pregnancy. You're going to need to consult guidelines for the current guidelines for indications for specific recommendations. It is not known if Esmolol is present in breast milk. However, due to the potential for serious adverse reactions in a breastfed infant, it's recommended that a decision be made whether to discontinue breastfeeding or discontinue the drug. All of this needs to be factored into consideration of the importance of treatment with Esmolol. The short half-life and the fact that it's not intended for chronic use could limit any potential exposure to the breastfeeding infant. In other words, so if it has to be done for the life of the mother, likely the baby is going to be okay, but you need to consider all of that. So with respect to drug interactions, there are many, too many to list here. Just know that Esmolol interacts with numerous drugs. Bradycardia may be observed more frequently in elderly patients greater than 65 years of age. Dosage reductions may be necessary for elderly folks. Anaphylactic reactions are a primary consideration. Use this drug with caution in patients with a history of severe anaphylactic reactions. Patients taking beta blockers can become more sensitive to repeated challenges, so stop and think about it for just a second. Treatment of anaphylaxis is epinephrine. In patients taking beta blockers, these drugs may be ineffective or promote undesirable effects. Extravasation is a problem with this drug. Make sure the proper needle or placement of the catheter prior to and during the infusion. To avoid extravasation, which is skin necrosis and sloughing off of the skin, avoid infusions into small veins or through a butterfly catheter. Additional adverse effects are hyperkalemia. Huge spikes can be seen in serum potassium. These patients will develop hyperkalemia, especially in patients with severe risk factors, to include renal impairment. So you have to monitor serum potassium during therapy, especially if they're in surgery. Another adverse effect of Esmolol includes hypotension, and this can occur during surgery. So your patient's blood pressure is going to be closely monitored. If a patient exhibits an unacceptable drop in blood pressure, a reduction in the dose or discontinuation can reverse this hypotension, usually within about 30 minutes. Now, Esmolol is considered a soft drug, one that is rapidly metabolized to an inactive form. Its elimination half-life is as short as 9 minutes. It's rapidly metabolized by hydrolysis of the ester linkage by carboxyl esterase enzymes. And that's it for Esmolol.